His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. The fluorescent lights hummed above the hallway, casting a thin, sterile glow that made the late-night scrub of the hospital feel almost like a quiet ballroom. I could hear the distant sigh of the ventilation system, the soft thump of a cart rolling past, and the faint, lingering scent of antiseptic that always seemed to cling to the linoleum like an old perfume. He was a lanky fellow in his late 20s, his jaw clenched as if he were trying to keep a secret from his own teeth. He wore a faded denim jacket over a plain tee, the sleeves rolled up to reveal a tattoo of a compass on his forearm, an odd detail that made me smile. He'd been in the emergency department for about an hour, waiting for a tetanus booster after a minor scrape on his shin that he'd gotten while hiking. The scrape itself was nothing more than a shallow bruise, but the idea of a needle seemed to have turned his stomach into a knot of nerves. I slipped on my latex gloves, the thin material stretching over my fingers like a second skin. The texture was cool, almost like the surface of a marble countertop, and the scent of rubber mingled with the antiseptic, a reminder that I was about to become a conduit between medicine and his fear. I could hear his breath hitch, the way he inhaled sharply as if trying to draw in courage. "Okay," I said, my voice a little slower than usual, as if I wanted each word to linger in the air. "Let's find a nice, smooth vein together." I leaned forward, my forehead almost touching his. The proximity made the room feel smaller, the hum of the lights louder, the scent of the disinfectant more pronounced. He gave me a nervous smile, the kind that reaches the eyes but never quite settles. I lifted his sleeve, the fabric sliding off with a soft rustle. His skin was warm, a subtle heat that rose from his forearm, the kind you feel when you place your hand on a cup of tea that's just been set down. I pressed the tourniquet, actually a simple elastic band, just above his elbow, tightening it enough to make the veins pop like delicate chords in a piece of string music. The skin turned a faint shade of pink, and there, a vein stretched like a silver river, its walls smooth and inviting. "See that?" I whispered, pointing with my gloved index finger. "That's the one we're looking for. It's the best spot because the wall is thin and the flow is steady." I could see his eyes flicker, a flash of curiosity cutting through the anxiety. He nodded, the motion almost imperceptible, as if he were trying to convince himself that he understood. I cleaned the site with an alcohol swab, watching the vapors evaporate in a tiny cloud that caught the light and disappeared. The coolness of the swab left a tingling sensation, a brief reminder that this was a clinical ritual, not a romantic tableau. Still, there was something quietly intimate about the trust he placed in my hands, the way he allowed me to be the one to pierce his skin. "Do you ever get nervous about needles?" I asked, half joking, half serious, letting the humor float like a feather. "I promise it's not as dramatic as a horror movie." He chuckled, a short, nervous sound that made his shoulders relax just a fraction. "I've always thought it's the fear of the unknown," he said. "Like, what if the doctor misses the vein and I end up with a bruise the size of a small planet?" I smiled, feeling the lightness of his humor seep into the room. "That's why we look for that smooth, straight vein and use a gentle angle," I replied. "I usually aim for a 30-degree angle relative to the skin, keeping the needle bevel up. It's like a tiny dance, smooth, controlled, and you end up where you want to be without stepping on any toes." I positioned the syringe, the barrel glinting under the lights, the plunger ready to deliver the vaccine. The needle was a slender, stainless steel instrument, no longer than a grain of rice, its tip honed to a fine point. I could feel the slight resistance as it entered the skin, a whisper of pressure that was both firm and soothing. The skin gave way with a soft pop, the sound barely audible over the distant hum, and the needle slipped into the vein with a satisfying ease. "Almost there," I murmured, watching the tiny bubble of air rise to the top of the syringe. "We'll make sure there's no air in the line. No one wants an air embolism, even if it's just a little bubble." I withdrew a milliliter of the vaccine, the fluid glimmering amber against the white of the syringe. The speed of the injection mattered. A slow, steady push let the medication flow gently, reducing the sting. "I like to inject over about 15 seconds, I said, a little rhythm in my voice as I counted in my head. "It gives the tissue time to relax, and it keeps the patient from feeling a sharp jab." He breathed out, a sigh that seemed to release a fraction of the tension that had been coiled inside him. The needle's presence was now a quiet, almost invisible line, a conduit for the vaccine that would protect him from a nasty bacterial foe. I held the syringe steady, letting the fluid seep into his bloodstream, the way a river merges with the sea. When the plunger reached the end, I gently withdrew the needle, the sensation similar to a feather brushing against skin. The site was now a tiny red dot, a reminder of the moment's intimacy. I pressed a small piece of gauze against it, the cotton soft as a whisper, and asked, "All good?" He nodded, his eyes meeting mine for a beat longer than usual. "That was not as bad as I imagined," he admitted, a shy grin forming at the corners of his mouth. "You make it feel less scary." I laughed, a light sound that seemed to fill the corridor. "That's the magic of good bedside manner," I said, tapping the gauze lightly. "And a little bit of chemistry, both medical and conversational." We chatted a little longer about his hiking trail, the compass tattoo, and how he'd planned to head back to the mountains after his appointment. He mentioned he'd been on the road for a few days, a traveler far from home, and how the hospital's night shift felt like a refuge, a place where strangers became allies for a moment. I took the opportunity to slip in a quick tip about wound care, because why let a good teaching moment slip away? If you ever get a scrape again, clean it with mild soap and water, then apply a thin layer of antibiotic ointment before you cover it with a sterile bandage, I advised. Keep the area dry for a day or two and watch for any sign of infection, redness spreading, warmth, or pus. If you notice any of those, it's best to get checked out sooner rather than later. He nodded, absorbing the information as if it were a map for his next adventure. The night shift nurse on the other side of the hall called his name, and he rose, his shoulders a little less tense, his steps a touch more confident. He reached for his jacket, hesitated, and turned back to me. "Thank you," he said, his voice softer now, "for the needle and for the conversation." I smiled, feeling the gentle warmth that lingered in my chest, the same warmth that fills a cup of tea held between two friends at midnight. "Anytime," I replied, the words slipping out like a promise. "Take care of yourself out there, and remember, sometimes the smallest gestures can be the most comforting." He gave me a nod, the kind of nod that carries a quiet gratitude, and slipped out into the hallway, his footsteps echoing faintly against the tiles. I watched him go, the lights flickering overhead as if the building itself were breathing. The room seemed a little larger now, the scent of antiseptic mingling with the faint perfume of fresh coffee from the nurse's station. I turned back to the empty bed, the gauze still resting on the skin, and let a soft sigh escape my lips. The night was still young, the corridor stretched ahead like a quiet river, and somewhere in the distance a patient's heart was beating a steady rhythm, trusting the hands that held the needle. I lingered a moment longer, feeling the quiet power of that trust, before stepping out into the hallway, the soft click of my shoes a gentle reminder that every touch, every pause, carries a whisper of care.